Hi, everyone. I'm Senator Martin Heinrich, and I'm really excited to sit down today with Dr. Heather Pratt-Chavez, who is a leading pediatrician at the University of New Mexico Health Sciences Center and Medical School. Personally, as a parent of two teenage boys, I thought it would be really helpful for parents around the state to hear directly from a leading expert about the COVID-19 vaccines that are now being approved for children's ages 5 and up. And a safe and effective dose of the vaccine for kids is a really critical step in helping us continue to fight this deadly virus and, frankly, in getting us back to a more normal existence that I think we all want. They're also really needed even more now with the rise of the Delta variant. The Delta variant is still spreading at really alarming rates, including in our state, and particularly among unvaccinated New Mexicans. And this has created a new and pressing risk to unvaccinated children and adolescents as well, to their families and to the surrounding communities. So with the recent approval of safe and effective vaccines for kids, we can finally make a real difference in saving lives and protecting the health of our children. But just like with adults, we are only going to be successful in protecting the health of our families and our communities if as many of us as possible do our part and get vaccinated. For more information about scheduling vaccine appointments in New Mexico for your children or for yourself, I would encourage everyone to visit the website vaccinenm.org. So that's vaccine, VACCINE, nm.org. But before we get into questions, I want to say as a parent myself that I know how seriously we have to consider questions about what is best for the health of our kids. It's understandable for parents to ask these types of questions and all sorts of questions. And that's why I thought it'd be really helpful to talk through some of those questions that parents have in New Mexico about vaccines with someone who really is a leading expert, unlike myself. So why don't we get started? And Dr. Pratt-Chavez, I hope you can just quickly tell us a little bit about yourself.
Sure. My name is Heather Pratt-Chavez, and I'm a pediatrician. I work at UNM hospitals in Albuquerque, and I'm a general pediatrician. So I take care of little kids from the time they're born until they're about 18 or 19. And I take care of them both doing their well child checkups. And then I also work in the very busy, dynamic pediatric urgent care, which is almost like the same thing that we do in the pediatric ER here at UNM Hospital in Albuquerque. And then I also take care of newborns in the newborn nursery quite a bit. So I have been doing a lot of checkups with kids and their families where they have questions about the safety of the coronavirus vaccine. And I think that the discussions that we're having are really related to parents wishing that they could have a little bit more control and something that would make them feel a little more secure in their child's health. And so relying on the relationships that we've built through the years, we try to talk about how we'll be partners in this decision making. And so I think that that would be the main message I would like to give to parents and families during this time, is to really look to their pediatrician as their support person to sort through all of this information. Because I know, Senator, you guys are in government are just getting this flood of information all the time from different sources and experts. And we are, as well as doctors, trying to sort through all this new information coming up, the new information about how many cases there are, the different types of vaccines, what happens for the vaccines, what happens to little kids if they get coronavirus. So it can be just so much information to sort through. So I'd really like to encourage families to use their pediatrician as their partner, sorting through this mountain of information that can be very confusing.
So as a pediatrician yourself, what do you look to, how do you know that, for example, this Pfizer vaccine is safe for that pediatric coterie of 5 to 11?
Yeah, so certainly, I start with my colleagues and experts that are around me. Working at an academic institution, I can talk to the pediatric pharmacists who are experts in vaccines and the doses and the preparation and the delivery. So meaning, I ask them, what's the difference in the dose for this pediatric vaccine? And it is 1/3 the dose of the adult vaccine. It's given in
Is
a
that the result
smaller.
of the studies that were done previous to it being approved?
That's correct. So I'm talking about the Pfizer vaccine that's
Right.
just been approved. The dose for the little kids from 5 to 12 is 1/3 of the dose
Gotcha.
for the adults. And so what's super cool is that we found this like nice smaller dose for little kids that provides the same protection and safety for these little guys that we can do it safely and prevent coronavirus infections. So
And-
I love the pharmacists, and I have infectious disease experts and my colleagues, and we talk a lot about it and really help each other sort through our approaches to this really significant amount of medical evidence that can be really hard to think through. So we rely on our training and our experts, and certainly, I was just talking with your staff, Senator, about my favorite websites, of course, are the CDC parenting website and the American Academy of Pediatrics, healthychildren.org,
Yeah.
right? So
Great.
they help us. Yeah.
So it's healthychildren.org and cdc.gov, right?
Yes.
Fantastic.
Yep.
Can you talk,
Yeah.
because you're at the nexus of so many healthcare professionals that bring different points of view to this, different expertise, probably even see some of the data in different ways. Are you able to synthesize that into your conversations with parents?
Right. So what we do, I'll give you an example. I was doing a checkup for a family that has really been hit hard by COVID. They've had some extended family members who were older who died from COVID. They had job losses in the parents' jobs. One of them lost their job. The other one is sort of like on temporary work because of COVID. And then their kid, who's a high school age kid, was having a lot of anxiety and stress really related to COVID. So there were all these ripple effects from COVID for this family, and they were nervous about the vaccine for their high school age kid. And I think it was because they had so much in their life that's gone out of control because of COVID and such hard negative effects. They were feeling stressed. And so for this family, we talked about what the benefit would be for the rest of their older family members if their daughter got vaccinated, because then she would be protecting her elders from getting exposed to the vaccine. And this was actually the answer that the family was looking for, because they want to figure out ways to keep everybody else safe in their family. And so it was a real relief for them to have that perspective and for her to get this vaccine. And she felt a sense of community and a sense of pride in getting the vaccine to protect the elders in her family. And that was a really lovely moment.
And, having been around my own kids and other kids that have been able to get vaccinated, I get the sense that oftentimes that's a reduction in stress and anxiety for kids that are going to school in different social settings and don't want to be bringing something home to their families.
Right. And we were just reviewing the timing when you were talking about kind of the experts and synthesizing things. And what's super exciting is that if we can get our little kid cohort vaccinated right now, they're going to be fully protected by Christmas. And how lovely would that be for families to be able to gather with the grandparents and the aunties and the uncles and to have the little ones there and to feel much more safe being all together. I think that is
great.
really exciting.
How can those of us, just anyone in the community who has already been vaccinated be helpful in just building that confidence for parents, for kids, for family members, or other community members?
I think it's really important to not be dismissive of people's concerns and fears. I think we're all running hot. We certainly all have just a higher level of stress and anxiety since COVID, and that can come out in different ways. And again, I'll come back to this idea that I think families, we all want to have some control in this scary world affecting pandemic that's spun everything. All of our systems are disordered. And so everybody's anxiety is a little higher. So I think we need to respect that families are stressed and that they are anxious about things, and to listen in a compassionate way, and to talk about our own strategies that we've used to relieve our stress. And for me, when my daughter got her vaccine, I didn't know how much stress I had built up about her getting COVID. I was scared for her to get it. I was scared for her to be around my parents. I was scared, what if it's in our household? What that would mean for myself and for our family in terms of not being able to go to work. And when she got the vaccine, I just felt like this sense of relief and a bit of lightness. And I cried my eyeballs out in the parking lot at the state fairgrounds after she got her shot, and had to really collect myself. So I think that if we can respect people's concerns and respect, that it's a stressful time, and take our time to listen to people, I think we'll be able to build relationships and support each other through this really stressful time.
Well, what have I not asked you? What else do you want to share with folks as they're going through this process in their own families?
Yeah, I think, well, here's some really exciting things. You mentioned how to schedule the vaccine. What I'm really happy about is that in my clinic here at UNM Hospital, we have the COVID vaccine. So it's my group, my team, we can give the vaccine in our well child visits. So I can be there with families, and we can talk, and we can hold hands, and we can cry, and we can work through everything and give the vaccine to little kids together. So I would really encourage people to talk to their family doctors and their pediatricians, and to get the vaccine in the clinic with their family doctors. And then I would also like to say our group organized a big vaccination event for Saturday, and we had 600 spots, and they are gone. So wow. I think there's quite a bit of enthusiasm. A lot of people, Senator, really the majority of people that I talk to about the vaccine in the various settings in the hospital, they want it so bad for their little kids. So I think we're going to see really a lot of people really want it, and we're going to see really good numbers of kids getting vaccinated.
That's great. I know my kids are a little older than that age range, but for them, they were super excited to get vaccinated, because I think it brought more normalcy back into their lives afterwards, and right. They were craving that. So this has just been a great conversation with Dr. Pratt-Chavez. I can't thank you enough for joining me. I really hope that our conversation helps parents and families who are trying to make the right decisions for their children. And if you're watching and you have additional questions, as the doctor said, chat with your child's pediatrician or your family doctor or another healthcare provider that you trust. And again, for more information about scheduling vaccine appointments in New Mexico for your kids, for yourself, once again, visit vaccinenm.org. That's vaccinenm.org. And thank you again, Dr. Pratt-Chavez, for all your work in supporting, New Mexico's kids, but our entire community in our state. We really appreciate all that you do.
Thanks. I appreciate it.
Thanks, everyone.